CEO has left the SHA, left our health authority in the middle of a pandemic, and the Premier does nothing to tell us why that happened.
The leader of the official opposition is looking for answers after the sudden resignation of Scott Livingstone.
How on earth, after months of ignoring the experts, how on earth, after this incredible mismanagement of the fourth wave, how does this Premier expect to recruit anyone to fill the big shoes left behind by Scott Livingstone?
The Premier didn't shed any light on Livingstone's departure, but says the SHA quickly found a temporary replacement.
CEO from within the organization that will ensure that there is no disruption in services in communities across this province.
Scott Livingstone gave his resignation notice the week before last. He hadn't appeared at COVID-19 press briefings since early November. A health policy consultant says the CEO's abrupt departure casts doubt on the organization's stability.
I mean, it's difficult for anyone to conclude that this was a smooth and planned departure under ideal circumstances.
And recruiting a replacement could be difficult, he says.
It's not an ideal kind of job to come to unless you're kind of a firefighter by nature and you love conflict and managing it and seeing through a situation from one crisis to another.
Retaining burnt-out healthcare workers will also be challenging, says another policy expert.
We have an exhausted team, staff. We have this really high risk of an exodus of individuals. If they were ready to retire before, now appears to be the time.
Two healthcare unions we spoke to say employee retention is a top issue they hope the new CEO tackles. They say there's a staff shortage crisis. The SHA has not yet announced a timeline to find a permanent replacement for Livingstone. Yasmin Ranea, CBC News, Saskatoon.